Hello, my name is Ivan Prudnikov, and with this video I'm going to try to close Learning Outcome 2 for Module 3. We're going to talk about echograms of my patients and their collaborative partners. We're going to talk about my collaborations with different healthcare providers, and of course about my role as a physiotherapist, my boundaries, and etc. Enjoy! As you remember, my older patient is Tatiana, 68 years old woman in old age stage of development, and my younger patient is Maria, 9 years old girl in school age stage. None of them has GPs or some specific specialists, just family, friends, and individual collaborative partners, specific for their age and stage. Let's take a look and compare them and also my patient's interactions with them. I analyzed and split up Tatiana's interactions with her collaborative partners into 3 main groups. First 2 groups is going to be about symbiosis. I will explain the differences. And the last group is going to be about commensalism, or a freeloader if you want. The first symbiosis group is going to be about Tatiana's close family members from younger generations, such as her adult son or her grandkids, me, for example. I decided to call it a symbiosis because of our work together. Tatiana provides us with her experience in life, and we share with her our knowledge and experience in new technologies, or maybe we can give her an advice like what to watch on YouTube. The second group is going to be about one person, her husband. They live together and of course have the closest relationships. They always share their experience and knowledge, help and support each other, not only mentally, but physically. That's why I think that we can call it the full symbiosis. And the last group I called freeloaders because of one-side interactions in it. This group is about other Tatiana's family members, who is either too young or too old. They can give Tatiana a lot, and she doesn't need it, but she still is helping them with their mental problems or physical problems, and also she shares with them her experience and advices. It's also important to say that Tatiana doesn't have a lot of friends in her age. Yes, most of them are not with us already. That is something sad but obvious. That's why I think it's more important for me to mention that as time goes by, our opinion on what is right changes a lot and becomes more rigid. Since we all are trying to surround ourselves with people like us, it becomes an obstacle on making and keeping friends. Maria. Maria has good and healthy one-side relationships with her school. It provides her a lot of good friends, a lot of experience, knowledge, and of course sometimes headache. But that's totally fine. With her friends, Maria also has good and healthy relationships. All of her friends are open with her and she's open with them. And I'm not sure if I can say something more about this topic. But I would like to say more about her interactions with family. Parents, of course, is the most important part of everyone's childhood. Parents give us love and respect, and Maria's parents as well. They also support her interests and help her with her troubles in school and daily life. But I become bored when I say obvious stuff, so let's move on to her older brother and sister. When I asked Maria about her collaborative partners, the first person she named was her older sister Katya. She loves Maria a lot and plays the role of an example for her. In my opinion, Maria really wants to be like her older sister, but will deny it if you ask directly. And her older brother plays the role of an example not for Maria, but for her future companion. He teaches Maria how to find respect and always wants her to be happy and safe. As I said before, none of my patients has GPs or some individual specialists. So before the conclusion, I would like to suggest which specialists could be useful for them. For Maria, I would suggest to find a good traumatologist, since she's extremely active. She's always jumping, tumbling, and standing on her hands, and it may lead to injuries. Besides a general checkup, once or twice a year, I would advise Tatiana to find a good psychologist, since she was complaining about her stress because of some events in her country, and also because of the thing about opinions that I mentioned before. I think it would be nice and useful for my patients. And also, the good thing is that it's gonna be one-side relationships where they don't have to help anyone or share anything. They just need to take help. Now, we are ready to make a conclusion. During our childhood, we affect on people, of course, but not directly. We mostly take something from them and learn how to give. But we are equal with people in the same stage of development. We are equal with people with the same amount of experience and knowledge. As time goes by, our skills, knowledge, and experience grows, people respect us more and may ask us to help, share, and give. Tatiana has a lot of experience, so she usually give people something, share with them. And Maria has not that much to give, so she mostly takes something from them. That's how I think it works. But it's also important to mention that it's not only connected with life stages and ages. As I showed here in Tatiana's first collaborative partners group, everyone has different experience, knowledge, skills, and you can find something new for you everywhere. Whew, thank you, Vanya. And I am Vanya. I will tell you about my collaboration with different healthcare providers. Our collaborative partners and life stages are connected, as you understood already. So it would be more comfortable for me to collaborate with my peers than with some old guys. And my comfort during work is also important, by the way, because it provides better results. That means if I want to work with a specialist, it's better for me to find a specialist of my own age. Well, it's hard, but let me ask you a question. When did you know math better? At school or now? If you answered now, then you either lied or at school. Yes, that's my point for me to work with other students I know, because they are studying right now and know their work better than anybody. And I just decided to work with their knowledge, not with some specialist's experience. So, in my team, except me, I have two incredibly smart girls from the best Russian universities. Sasha studies medicine because she's gonna be a surgeon, and Nastya is a future psychologist. Both of them are interested in what they're doing and have a lot of motivation to learn more, discuss, and argue about some topics. So they were excited when I asked for their help. And I asked a lot. Not only for help, but we were also discussing some cases from my practice and from there as well. That's actually the reason why I'm telling you about them, not about some guys in the hospital. I actually work together with them, so in my opinion, that's the best example of my collaboration with healthcare providers. Sasha is my walking and talking encyclopedia. She's always ready to help me with anatomy and physiology. We were discussing a lot of exercises, why each of them is good or bad, and also which one is the most relevant for my patient and what is the best way to perform it accordingly to the biology of human's body. The most part of my reflections is inspired by Nastya. She was helping me with Erickson's theory and still checks my plots for those videos so that I don't say stupid things. We are working with her on my communications with my patients, and sometimes we analyze my patients together so that I could make a better plan for them. Thank you, girls. That's my only collaborations for now, because I'm a student and still learning how to work. But physiotherapists are actually collaborating with a lot of other healthcare providers. I showed you already some examples that are connected with my patients, and now let's take a look at it in general or with made-up examples. Let's just take the whole case of the patient that I made up and take a look at his journey in a hospital. At first, our patient will go to the therapist, and after that the therapist will send him to me, and also will give me some information that he knows already about this patient. But actually that's not always the case, because sometimes I'm gonna work alone and I'm gonna be the only doctor for a specific patient. But we are making up this story, so that's fine. After that, I will perform the screening and the history taking to make sure that the therapist did his work well. And for example, we'll find out that my patient has a problem with his gait. Well, maybe it's some childhood's mental trauma and I have to work with a psychologist. Maybe the reason of his wrong gait is surgery that he had before, such as a knee replacement, for example. Then I will color meet his previous doctor and orthopedic surgeon and will work with them to find out more important information and details. Maybe the actual problem is in his muscle strength. Then I'll make a training plan, of course, and I will work with a nutritionist to make a better diet. As you can see, physiotherapists are very collaborative and work together with a lot of different specialists. That's actually the big part of our work, to communicate not only with patients but also with other healthcare providers. Wait a second, we collaborate a lot, okay, got it, but what's the point of the physiotherapy itself then? Of course, I have an answer. That was just one from 7 roles of a physiotherapist. As well as collaborators, we're also communicators. Watch video for LO1. Innovators, cause science and medicine are always going forward and we may invent some new treatment techniques or exercises or just be the first one who'll try it. Reflective professionals, cause we always have to think about the best way to perform the treatment, analyze our work and improve our skills and knowledge. Organizers. During making a plan, we have to keep in mind so many individual aspects of the patient: environment, age, socio-emotional development, mental health. You got it. We are also health promoters. This one is easy. After earning patient's trust, we manipulate him and explain why it's better to live a healthy life. Also work with their environment to make sure it's going to be an improvement even after the treatment. And the last one, healthcare providers. I'm not even sure if I have to describe it, but okay. Screening, history taking, examinations, diagnostics, treatment plans, coaching and guiding. Yes, that's literally everything. But let's go back to my patients, if you don't mind. During Tatiana's intake, she told me also about her stress. So, as a physiotherapist, I'm gonna check not only her lower back, but also her mental health and environment. We professionals call it the BPS model, or biopsychosocial. Biological factors for Tatiana are gonna be her chronic diseases, her lower back and a little bit her knees during some movements, and her age in general. She's not a kid anymore, she's 68. Her stress is caused by war and politics in the country she lives in, but she's handling it great because of her skill of reflection that she improved during her life, and now may use it perfectly on her old age stage of development. That's her psychological factors. The last one is her social factors, and as I said before, she doesn't have a lot of friends in her age, but she has a supportive family and husband who are helping her with her mental health and physical as well, as you can see. For Maria, it wouldn't be the same. She actually has a great health and no complaints, just not flexible enough, and that's actually the whole reason of our work. But I always have to remember that she's 9, not only during the dialogues with her, but also when I'm making a treatment plan. Psychological factor for Maria is her stage of development, because she needs more attention than Tatiana, and also her possible stress because of school, for example. Socially, Maria has a lot of contacts in her family, she studies in school, has a lot of friends there, and also a lot of hobbies that may have a positive effect or sometimes negative if she's too tired, for example. As an organizer, I have to analyze the whole information I have to use it to make the best possible treatment plan for each patient. As a collaborator, I will work with Sasha and Nastya, or with Maria's possible traumatologist and with Tanya's possible psychologist, to understand their case better and make a better treatment as well. My communication role I will use during the whole process by communicating with my patients and also with my colleagues from different fields. I won't show you the innovator role during the education because everything I do is new for me, but only for me. As a healthcare provider, I will perform the whole work, but for me now it's only the diagnostics and treatments with coaching and guiding. As a health promoter, I will do my best to improve their future life by making it and them healthier. And as a reflective professional, I will analyze my work after that and will improve my skills and knowledge. We are almost finished. Now I have to say about things that I can help with, and not even because I'm a bad student, but because of the physiotherapist's boundaries. Physiotherapy may help you with a lot of things in a lot of fields. We work with your lifestyle, bones, skin, muscles, and also with other specialists, as you know already, but sometimes it's not enough. That's why we have a screen actually. During this procedure, we may find something that we call a red flag. Red flags are showing us that we can't actually help the person, and in this case, we have to send the patient to the other specialist. Those red flags may show us the signs of the thrombosis, cancer, infection, and much more, and in those cases, we are not able to help. I'm destroying my health today to save your health in future.